Hello, it's Hillary from Apothecary and Company, and today we have Dr. Rai, who is an integrative psychiatrist, and I think it's going to be a great topic. We're going to talk about what integrative psychiatry is and more of the ADD, ADHD realm and all the intricacies within that. So welcome.
Thank you. Nice to talk to you online and see you face to face. I know we connect offline as well. Thank you so much, Hillary, for giving me this opportunity. And I know we talk constantly about integrative psychiatry, so it's so nice to be here and talking to everyone, whoever listens to you and whoever will listen to this later on. I'm Dr. Rai. I am an integrative psychiatrist. And like Hillary said, that um, integrative psychiatry is something that's not very well understood, or sometimes people get very confused what integrative psychiatry is. So I'm going to try to explain that in simple, very simple terms. So psychiatry, Western psychiatry, or psychiatry in general, is a branch of medicine where we do medical school, you do your residency, and you train in psychiatry, and you are really well trained in prescribing medications and at the same time therapy as well, which a lot of Western medicine or psychiatrists in United States will end up prescribing medications. That's the major modality, and then other modalities as well. What There are a group of psychiatrists, and now I'm talking about integrative psychiatrists, who are very well trained, board certified in doing that part. But at some point of their life, they decided that, I don't think we are helping our clients, of course. We are treating them, but the major difference is I don't know if we are going to the root cause and helping them go on a journey where these clients can heal themselves. So, what integrative psychiatry does is integrate the Western world or Western modality of medication and the Eastern world where nutrition, um, you talk about functional medicine, you talk about infections, or you talk about autoimmune conditions. And then you talk about modalities like meditation and yoga and exercise and diet, incorporating all of those modalities along with minimization or optimization of your medication and understanding the clients, what do they really need. So the unique approach that an integrative psychiatrist has is, okay, I can meet you where you are, but I'm going to treat you as one single person and an individual person who I'm going to try to get to the root cause of what's the reason that you are having a certain symptom, or what is the root cause that you are suffering. If I need to use medication, I will use the medication. But we as an integrative psychiatrist see medication as a band-aid. So you have been wounded, let's say, for a long time. We will use medication. I want to make it very clear to everybody, an integrative psychiatrist is not anti-medication. We will use it, but we will be very mindful that we are using it as a band-aid. And then we work very closely with you, do everything we can to get to the root cause, and then start working on the healing process. So then you start feeling better. And I think what happens, Hillary, at the end is what I see in my clients. Being a psychiatrist, it's very hard for a psychiatrist to say that their patients can graduate. And I do that in my practice. And I tell them it's not I did anything. It's that took a journey together. And when you find out what the root cause is to your problem, you will start feeling better. And then you take on the power, which actually you gave it to your doctor and you gave it to the medication. So that's another difference between an integrative psychiatrist. We like for our clients to have the power to start working on healing themselves. it sounds very simple. It is not that simple. It is very complex. Sometimes we have to push people, and sometimes we have to say, hey, because it's literally like breaking old patterns
Mhm.
and finding new patterns. So I know I said I'll make it simple,
I
but
think it's also very important to point out that it almost teaches that person, it brings awareness. So
mhm,
sometimes it is okay if they, and I don't want to say they're going to go backwards, but if you go backwards and you get to that point where you were before, you now have the tools to work through those things,
mhm.
and the people to help you through that. So I mean, I find that doing that in my consultations, even with myself, I think I'm status quo and then I take two steps back, but I have to reevaluate everything, bring those tools back in. And so I think that's also something very important and that people don't lose sight of.
Yeah, yeah, and it is very important because um, I tell people that everybody cannot work with an integrative psychiatrist. Everybody can work with a psychiatrist, because I think they come with a mindset of I want change right now. Like right now, that feeling of immediate change. But when you come to an integrative psychiatrist, you have to come with a mindset that no, this is a journey I'm going to take with you. And I will stick around with you only if I trust you, I connect with you, and we'll walk this together. I am not going to take responsibility and I am not going to take the power away because I do not, then the healing will not happen. Because I just need to remind you that you have the power. I will give you education, and I'll give you the knowledge that I have, but the change only will happen when actually you take on, like, okay, it's my time to wake up now. And you've seen probably with your clients, like, we have to redirect them all the time. Okay, this is a supplement, this is this, and you can take this, but at the same time, you have to start changing your habits and your nutrition and routines around you. So, and then many more.
Just in the past, well, since the pandemic, I have the privilege of filling prescriptions, and that's why I made the switch of what I did. I didn't want to provide that traditional band-aid anymore. It is a conventional medicine is still very important, and I like these band-aids when they're used short term, right?
Mm-hmm,
So we've seen a very big uptick in ADD, ADHD medications. So I
mm-hmm,
know that this pandemic has really affected people.
mm-hmm.
Can you say anything to that?
Yeah, of course. Like, oh, yeah. So this is what happens when you connect with people that you align with. So I was practicing like pure Western psychiatry till till I would say like pre-COVID, right? During COVID, it also hit me. And then I signed up for integrative psychiatry, integrative medicine, Ayurveda, and I said, I need to do something different. And I had my own personal journey that I went through during COVID. And I did and I opened my practice after COVID, of my integrative psychiatry practice that I do right now. So it started during COVID. And of course, ADHD, ADD, and anxiety were some of the things, like you just said, exactly. I totally agree with it. They were just like, the storm just hit everyone. And it came like left and right. Like, so far, a lot of people would think that ADD or ADHD is just a diagnosis that's adolescents or kids can be diagnosed with, right? And then you start seeing these people who were inside a house, mostly on their computers, or we were forced to be on our computers. That was not our choice, or phones, or working on iPads. And then adults started realizing that, oh, I think we have ADD or ADHD as well. So just to kind of give the facts, like literally American Psychiatric Association have these numbers that if you have a child who has ADD or ADHD, 50 to 60% parents also have ADD or ADHD that was undiagnosed. What I'm trying to tell here, so, and this is why you will see me going, being an integrative psychiatrist, you'll see me quoting the American Psychiatric Association, but at the same time, I also am very immersed into all the research that's being done in the integrative world, like holistic world with supplements, right? So they found out that there is a strong genetic connection if you have a child. And sometimes that's how I get parents saying, you know what, I never realized this, but when my child went to the psychiatrist, and then the psychiatrist said, oh, your child has ADHD, and actually, almost 50 to 60% of parents have ADD or ADHD. What happens, Hillary, is you can have ADHD as a child or an adolescent. You might sometimes be able to cope with it and develop strategies so that you somehow develop a plan, a coping mechanism where you just survive, or you're getting by life, but it's not sustainable. It really drowns you by the time you are an adult. And the if ADHD was same thing, the problem that happens is when you are an adult, ADD doesn't present the same way it presents in a kid. It presents totally different, where it's way more confusing. I can't pay attention. I'm not able to pay my bills. I'm not able to pay attention to my kids. I'm juggling 3 jobs. I am trying to I am a bad mother because I can't get to my kid's game. I forgot my sister's birthday. Now my sister is not gonna like me. My in-laws are not happy with me. My job, my boss demands more from me. I am tired. I am fatigued. I'm having brain fog. I'm having headache, multiple things. So the ADHD that could have dealt with or treated in as a kid is, I am so glad now that people are understanding, and like we are talking, people are talking about it. How should it be addressed in adults? Because now there are many adults who are presenting with these, some classic symptoms, and some we can say not so. And I'm sure you are seeing a lot of the adults who are coming to you and asking you like, hey, what should I do? I am just fatigued, I'm tired, I am like, Hillary, I've heard people say they come in with depression and anxiety, which is most common. I'm anxious and I'm depressed, and I think I'm getting irritable and I'm lashing out and I'm not able to focus, um and then you find out that, okay, actually this is a different version of ADHD that we are seeing. And going back again to American Psychiatric Association, what they have done is they have divided ADD. When it started, it was just ADD or ADHD. Now they have divided it into different types. It could be inattentive type, it could be hyperactive type, it could be combined type. Um, and it has now taken a bigger umbrella of neurodivergence. Many ADD, ADHD kids also, adults just pass by, and then they don't understand that they actually had a lot of learning disabilities that were present along with ADD or ADHD. So it just, we keep talking, you will see that the topic will just keep growing when you talk about the symptoms of it. But I just want to tell, this is a myth, that if your kid is sitting quiet and like not jumping around and not being disruptive, then it is not an ADD. ADD is now even included as one of the specifier where autism, it could be combined with autism as well. So that's where I like the term neurodivergence, because that really gives a big umbrella where we can include all these people and then start working individually, like what is missing.
Do you
Or
think traditional psychiatry is looking at all those aspects? Or are they quick just to um just I don't want to say a quick Band-Aid. Are
Yeah.
they considering that?
So what I will say with the training in both in integrative psychiatry and traditional psychiatry has tools. So they are looking at it.
Okay.
And anybody out there listening, if you are someone who has read DSM or read into traditional psychiatry books, Hillary, you'll be surprised. They do mention it. They will mention that, but then they will add not enough evidence, or there is not enough evidence that. So they do acknowledge this very clearly that it is genetic. They acknowledge that brain waves are different, brain imaging is different in an ADHD kid and non ADHD. But what they do at the end of the day, they just narrow it down to dopamine, that there is deficiency of dopamine. So the treatment will be just to give stimulants, which I will say there are cases where you do need to give stimulants. And I don't want anybody taking medication to feel that we are not for you. Like I said, I'm going to meet you where you are. It's the optimization of that band aid. When can we take off that band aid? That's traditional psychiatry is limited in that part. And that's when our integrative or the holistic part comes into play, where we dive deep and then look what else, what is traditional psychiatry not looking at, that we can look with the other lenses and help our child to not have the side effects that a stimulant. Anybody out there who takes stimulant knows the big side effects are the sleep problem, the loss of appetite, the worsening of the mood at times, getting irritable and angry when you take it sometimes. So there are many side effects that you can actually kind of balance by this approach, and also understand the root cause of your ADHD, which is missed by traditional psychiatry at times when you talk about the other causes that are that could be leading to the ADHD.
Before we came on and we started recording, we were chatting about giving kids, we were talking about kids, tools or helping their environment make them excel, right?
Mhm.
When it comes to ADD, ADHD. If we were, and we'll kind of come back to that, but when I was growing up, there was Ritalin, right? And there was not many kids on it. I think we learned in that generation to give the kids ways to cope, right?
Mhm. Mhm.
We were more forgiving, I guess. But
Mhm.
nowadays, I feel like it's just, yes, it's that quick fix, and you're being annoying, leave me alone, and
Yeah.
go do something.
Yeah.
Do you find that's the case? Has there been a shift over the generations on how we kind of treat kids from a behavioral standpoint and giving them the tools? And then we can give that example of that one child that you were talking about, and how
Yeah.
he had to have a messy room to thrive. And I
Yeah.
like that. I don't think we
Yeah. So no, absolutely. I wish with the amount of education people have, it would have changed. I do think that perception that the awareness is there. I don't think it's changed much. When it comes to an ADHD child, they are very misunderstood, or even an adult. I mean, I know we are talking about kids, but I'll tell you, like, in kids situation, the parents know, and then they are being annoying, and then they are like, so what it comes out as is, oh, this child is misbehaved, the parents gets the blame, and then this child is not disciplined, and all of those behavioral. And that's what I said in the beginning. ADHD or ADD is not a behavioral issue. It's not an issue of discipline. And that's where parents, what you just said, would, before, when it was our time, and I don't want to say just yours, our time, we would, when parents would say, okay, go do something. What we did, we would probably go play or read a book, or we would just kind of like hang out with a friend, or we would be in nature or something, right? But now what's going on, the problem is, and what COVID did was, then immediately, or you will see in restaurant, and we all are culprit. We have a nieces, nephews, and kids that we are doing it to them. We'll say, go do something. My mom is busy, your dad is busy, and you put them on the iPad or you put them on the computer or the phone. That's even making the ADD, ADHD worse. You think they're attentive at that moment of time or they're not disturbing you, but what's going on right now? Let's say you have a battery of 100 and your dopamine is full. When you put them on those things, it drains your dopamine battery. So now you need Adderall and Ritalin even more because when that kid that goes away from that and now it's time to do the homework, the dopamine has already been drained. So now they're not going to do the homework and they're going to be more upset and angry, or they will lash out, or they will do something else to get the attention. Why? ADHD brain does not have the same number of receptors that a normal brain, I don't want to call normal, but non-ADHD brain has. So a ADHD brain is always looking for more attention, more reward, more reward, more reward. And what they do sometimes, to iPads and phones, and that's where sometimes it goes into the worst direction is when ADHD is not treated. It's well documented, well researched. These are the kids who are moving in the direction of addiction. You can call it nicotine, you can call it cannabis, you can hard drugs, alcohol, all of that. Why? Because you want that high. You want that dopamine high. People talk about sugar and this and that. Sugar is not causing directly anything. It's just you need something to get that high. Your brain needs that because it has less dopamine receptors. And then you get that. So old days, it was you were more moving towards nature, community, more like, talking to someone, complaining about, at least you were getting on a phone. But now the child is isolated and more going on iPads and more going on screen time. And that's making things even worse. Rather than addressing the causes, which is we now know from integrative lenses, is ADHD is genetic, ADHD is neurological, ADHD is nutritional. So you have to address all of those. And if we want, we can discuss a little bit about them. Is if you're not addressing ADHD from a genetic perspective, from a neurological perspective, from a nutritional perspective, and then the last but not least is the environmental perspective, you're actually not treating, you're not working on removing the band-aid. And that's where the big difference comes is I have clients that were on stimulants and now maybe on a minimum dose of stimulants, or my approach, and we'll get to the example you were talking about, is this kid is not even on a stimulant. Why? Because we met him where he is.
I think it's
Um,
powerful. If anything, that's like I love it.
yeah. Yeah, so if we address all of that or behavior, so like for example, what you were saying, I'll talk a little bit about it, not naming anything. Or so I have this one client whose mom was very, very, very concerned because this client was like just not listening, and the mom was like, okay, I just yell and then the word goes from one ear and comes out of the other ear. So they had it all in their head. It's ADHD, but it's a behavioral issue. It's a discipline issue. If we give, and it's so interesting that this client's um, um, significant other also has ADHD and is on medication and knows the side effect from this medication. So the client does not want to take medication and says, okay, that's why we found you. You were referred by someone, and then we want to do it natural way, right? So we started the modalities, we started in terms of nutrition, environment, all of that. The one thing which I was sharing with you was beautiful was when the mother came to me and said, I'm just sick and tired of like we are doing everything you are saying, but I just cannot enter the person's room. I just cannot because it's a mess. And then I just chuckled. And then she was like, I don't understand this. Like, why did you just smiled? And I said, you are looking at a person whose room is messy, but I am looking at a brain which is ADHD and loves the chaos at times. Because sometimes the creativity needs the chaos. The ADHD brain is finding peace in that chaos. In no way, shape, or form, I'm saying that a room which is messy. But you know, Hillary, I was surprised the amount, the kind of garment and the art that this person, this client, created after we said to mom, we gotta meet this ADHD brain where it is. So can you just like try to let go? Can you please try to, maybe not go in the room? And let's see what creation this ADHD brain creates. So we just have such a negative bias that we fixate on the negative stuff. But sometimes we have to also see as if I have a ADHD brain, how can I use that brain to create something good? So unless if you didn't have ADHD, you wouldn't be jumping from one place to another. Your brain won't be doing that, right? So it's not like you want to be doing that all the time. But when the creativity happens, it's okay to let go of it and then see that how much can I use this to my advantage?
I love it. I don't think we don't give enough thought to that.
Yeah,
Thanks for sharing that. What are your thoughts on, because is that more the environmental?
it is. It is more the environmental, but in the environmental part also comes all the dyes that we have, all the environmental pollutants we have, the organic compounds we have, the pesticide, the endocrine disruptors. So there are a lot other factors that come in the environment, but this is another very big thing that comes that is included in the environmental factor. Yeah.
What about food?
Yeah, so food and nutrition, the nutrition is a big, big, big part, right? When I talk about nutrition, how I divide it is as I do like to talk to them about the big picture, right? The one thing we really want to know is about, are we sensitive to certain group of foods? I have noticed in my practice now working with a lot of ADHD kids, the big ones we all know, it's not a surprise, are, the first thing you want to look at is the milk or the lactose, right? Then you want to look at the gluten part, like what's going on there. And then I really, if family is okay with it, I love to do a food sensitivity panel, which also tells me about the gut of the child at the same time or an adult. And I love to find out what is a 4 plus sensitivity or a high sensitivity. And I don't believe in taking too much away from a child because the child is already selective in eating. So I think what the test does is it does help me. But I don't base my practice on test. If you're not able to financially afford it, we go with the most common ones, which is usually most of the time gluten. So food, of course, the number one part. What you put in your body, it does matter. Number two is definitely looking at some of the key micronutrients, right? And I can name some of them, which I have seen in my practice helping kids the most, and now they're catching the buzzword as well, are the number one is magnesium. Number two is zinc and copper, like the balance between zinc and copper. Omega 3s, we know that for the neurons, and I mean, if we want, we can go in deep into it, why and how these are causing. Um, and lithium orotate, which is not lithium orotate, but I'm talking about natural lithium. Our soils have natural lithium. When the soils were not depleted and we ate food, we got natural form of lithium in our body. Now we don't have natural lithium. I'm not talking about lithium carbonate. I'm not talking about lithium medication. I'm talking about like lithium orotate, which is natural lithium that really helps us to calm, really helps with those kids who have hypersensitivity, hyperactivity, or irritability. But most of the one, if I want to focus on, would be the magnesium, zinc, copper, omegas, B6 along with it. The one that I do want to mention here when I'm talking about like the diet and the nutrition is, I don't know how many people have heard about it, but it's called OPCs. So it's kind of like polyphenols that's in grapes, blueberries, you know. People say it's in wine too because it's from grapes, right? Those polyphenols, that is something which integrative psychiatry has dived deep into it. And I'm going to quote Dr. James Greenblatt. He's one of the child psychiatrists. He has dived deep into ADHD, and he talks about how these polyphenols in high amount, if you give to the client, and a lot of my clients, if anybody is listening, they know they are on it. And what it does is now we are getting a little bit into neurozone, how ADHD is neurological. ADHD kids have something we call more theta waves. So our brain has different kind of waves. We have alpha, beta, delta, theta waves. I don't want to go deep into it, but I'll only talk about two. Theta waves are the waves which is you are daydreaming, you're not attentive, you just kind of like something comes to your mind and you just flow with it. But beta waves are the waves which is more attention, concentration, and you are more attentive. So these kids are seen to have, and then again, now I'm quoting more traditional psychiatry. They have done enough research where say, yeah, we are seeing that these kids have more theta waves and they are daydreaming, they're not paying attention, they're forgetting tasks. So how can we create more beta or beta waves? OPCs or polyphenols are one group of compounds that were found to do this, that when you start taking them, your attention starts improving. And then what happens is your number of beta waves start improving. So what we do is we can start with the supplement. So Hillary, whenever, and you probably agree with it, whenever we start even with a supplement, we we bring you back to baseline, but then we start incorporating diet because these supplements are some form of diet that were extracted from and converted into a supplement. So yeah, we I know we started with the diet, but I kind of covered the neurological part as well. It's a neurological disorder because of the changes in the brain waves that we see. Many people out there, if they have been to neurofeed, they have done neurofeedback. What we do in neurofeedback, we want to try minimize the theta waves and we increase the beta waves so that the brain starts getting used to the beta waves, which is more attention, focus, all of that. And we could do that with some of these polyphenols, as well.
I do want to mention, just because the pharmacist in me, when we talk about supplements, these are not the, I'm just gonna put a plug out here. This is not the TikTok supplements. This is not Amazon supplements. So a lot of supplements that we work with are professional supplements, and you and I have to have our practitioner license to even purchase these things, right?
Mhm,
And they're
mhm.
available out to the public, but know your sources and know that they are standardized therapeutic amounts. I'll get off my
All I would say is, of course, make your compounding pharmacy like your best friend. Because Hillary, you would agree and your clients would agree about this. The amount of knowledge and the sit down sessions that you will provide, no one will. Everybody knows how long you have to wait for a prescription to get ready and how quickly you are turned away. So they're not investing time. Compounding pharmacy person knows what they're compounding, right? But I'm not even talking about pharmacy, even the supplements. There are so much mixing and bad batches of supplements, and we see that on the news channel. We both have to be on top of these things because we don't know when a wrong batch or some company produces something, and God forbid if our client is taking that, our license is under scrutiny, right? Like, why did you even recommend something like this? So yeah, we connect on this. You know, I am very, very careful. And that's why so far I have not used any brand names, because I literally work with my clients and educate them. How can you pick a good supplement? What is a good supplement? Um, the mindset that supplement is not a replacement for a medication. The CGMPs and the USPs and all these tags, but sometimes not even those tags. You really need to know what you are working with. you know so it's a very important point that you brought up. um I'm sure you get clients like I get. They come with, I just was reviewing a new client this afternoon. There are like 10 supplements, and then I am like, oh my god, how am I gonna prepare myself? Because I tell my clients, everybody who's listening to me, they see me, they know this. They come with a bag. I- at least first appointment you have to bring everything. I am gonna see it by my naked eyes. I cannot trust anything. It's probably the OCD in me. I have to see them in person. You have to bring you, and you're coming to me for the first appointment. I'm sure you're nodding your head. You do that too. I'm gonna have to review, and then I provide them a second bag. What are you parting with? You are divorcing these supplements, and we are keeping these, and let's start talking about them, because people are spending hundreds and hundreds of dollars
Mhm.
on these supplements. So we are not here to promote supplements. Let me tell very clearly, they are already $1 trillion industry. We are here to help you natural ways, but also, like, I know, Hillary, you do this too. I have some of your clients. Get to the root cause, and then you won't need supplement for the rest of your life. You know,
Exactly. Yep. So we did environment, nutrition. What else are we lacking?
So we did environment. We did talk a little bit about the nutrition. We talked a little bit about the neurological aspect of it, which is the alpha, beta, theta, delta waves, and then how these supplements can help with that. And then we talked in general about the genetic piece, where I really wanted to focus on the genetic piece because I also want these adults, and now we can maybe dive into the adult part of it. I see so many adults, and I'm happy that they are coming to me. That, my doctor is not listening, my psychiatrists are not listening. They are like, you're not in college anymore, you don't go to school anymore, you're not failing grades. Why are you so worried? Like, why do you want a stimulant? And they look at us as like, what are we doing? But on the other side, they're not listening to me because my life is falling apart. Which, because and I will ask them, okay, do you have any kid that has ADHD? And they was like, oh yeah, all my 2 kids, 3 kids, someone has, if one person has autism, or they're neurodivergent, or someone has ADHD. And I'm like, well, maybe your psychiatrist need to reread the book that they learned, because the book does mention now that around 50 to 60% of the kids who have ADHD, their parents probably had ADHD. It was just not diagnosed, it was just untreated. So now let's talk about it, because the DSM, you might not have all the symptoms that the DSM book has. You might be presenting in different forms of so-called, adult ADHD, but it is genetic. It is, there are clear receptors, dopamine receptors, that are different, and there's mutations, and that's why you have less number of dopamine receptors, because there is a genetic component to it. Yeah, so yeah, I would be curious how much adults are you seeing, and then we can kind of dive a little bit into, like we were talking, adult and the perimenopause or the hormonal part of this.
Well, I think, a lot of adults, I mean, you almost are expected to have some sort of cognitive change, right?
Yeah.
And I think because ADD is such a buzz term right now, that we are quick to just grab onto that, and that is now our label, and that's our reasoning, right? And then we're going to get
Hmm.
on some stimulants.
Yeah.
But as we were discussing prior to this recording, it could be so many different things. We just talked about all these reasonings that can contribute to kids, but
Hmm.
now going into adulthood, it could be, I mean, it could be thyroid, it could be hormones, it could be all these things.
Yep, yep. And it could have, I one thing in the nutrition and the diet part I didn't address, which I mean we have to talk about it, is our gut. There are tests that you can do. There is something called HPHPA. It is a chemical which you can test in the urine. If it is high, or kynurine, if it is high, then what it is telling us that your gut is producing a certain kind of bacteria that is not producing enough dopamine, and that's why the byproduct is positive in your urine. So the gut dysbiosis, because of the different kind of food you are taking, so that also contributes to it. So gut kind of carries over even in adulthood. So that's why it came to my mind later. But yeah, you're right. So the adults that come to us, it could be many, many, many things. I really do want to mention one thing, and it's just something I learned, and I think I did share it with you, was during my sessions when I was not even paying attention. I'm treating this young girl for ADHD. Again, same thing. She's not, knock wood, she's not on any medication, doing very well, working for a law firm. So you can understand how challenging it is, right? So what I am working with behaviorally with her, she's telling me that how many work she's juggling in between. Um, but she is kind of thriving on it. She's an adult, she's in her 30s. And then I am like very fascinating. And then I find out, we talk a little bit more, and then she's doing fine, but not much is changing. Why? We have implemented, Hillary, all of the nutritional. This is a person who will stick to what I tell her. It's an ADHD person, but really we have an amazing repo. Her therapist is amazing. So we all work as a team. um, Nutrition part we have fixed. The diet part going very well. Really genetic component is there, and the neurological part we are working on very well. So then one day I am sitting in the session and we are talking about it, and she kept saying I have a hard time saying no, and I keep doing multiple stuff, but sometimes I feel like I don't finish them, or I miss something or that. And I'm like, yeah, it is kind of like ADHD symptom, but where is it coming from? And I'll tell you, like, I just had that aha moment, and I am like, oh my gosh, I am missing the trauma part. And it just came to me, and I said, you know what? Actually, your brain has learned to multitask. And not going into details, but this person, the traumatic event in this person's life was the challenging demands that the family had. And she was never a child. She had to grow up very early. And I know many people can relate with this. They did not have a childhood because the mother needed them, the father needed them, the brothers needed them, the sisters needed them. So they were literally multitasking. And I am like, oh my God, I need to work with you on unwiring and rewiring your brain, because your ADHD like symptoms are technically coming from the trauma that you have experienced in your life. So this is what we are talking about, guys. Like, it's about a journey. And as soon as, Hillary, we hit that, oh my God, I mean, it's been few sessions only since we did it, but the concept that, oh my gosh, my ADHD could be as deep rooted as my trauma was just kind of like mind blowing. Which, I mean, someone will say, oh, trauma is everything, or trauma causes everything, you know? But it is different specific kind of trauma. And I was like, and we could see clearly how this person has multitasked, not being able to focus because had to go from mother to father to brother to sister, this person's need, and was able to get by. But now hitting 30s, it's affecting the relationship, it's affecting the work. So this is kind of examples I'm talking about when it comes to ADHD, and it goes back to what you said. It's become such a buzzword now. But what I want to tell people is how I work with clients is I tell them, let's deconstruct this label of diagnosis. You don't want to carry it for the rest of your life. Like, if you see a doctor or psychiatrist right now who has five diagnoses for you, anxiety, insomnia, ADHD, depression, person borderline, just imagine walking with those five, like,
It would be
labels. Yeah, it'll be very heavy. Like if someone asks you, put those five on your face and walk with them, it would be very, very heavy. So that's another thing we do. We want to deconstruct the diagnosis, you know, and then you could do that many times when you approach ADHD from a point of view. And many adults, they have coped with it, but they need that approach. How can we address it differently when it is showing in a different way? Like you were saying, mind fog, tired, not being able to show up for my kids, not being able to show up for my husband. Now my relationship with my husband has completely changed because I'm always tired. I have brain fog. I am forgetting. Of course, it could be hormones, it could be your thyroid, it could be your iron, it could be your diet, it could be many things, but in the mix, it could be your ADHD unmasking again, because when you are in your perimenopausal period, your estrogen is dropping. So we check for it, right? We do the Dutch test or we do the testing for it. If your estrogen is dropping, we know from the Western psychiatry or even the Western medicine point of view, we know clearly estrogen is directly linked to dopamine and serotonin. Progesterone, more GABA, more calming. So when you lose the estrogen, you already have a brain that does not have much dopamine. And then you lose that estrogen, which was providing some dopamine and estrogen to you. So you can imagine, I mean, of course, you are getting all these procrastination, not finishing the task, like I am always tired, I don't have the energy. And then the word, what do they say? Oh, it's that time of your life.
I was just gonna say, yep.
I like being a, I am, I'll tell you, I tell my neighbors and my friends when they say this word, I'm like, do I need to like shake you or something? Like, I feel offended as a male that you just said that to yourself. It's not right to say that to yourself. Nobody should say that to you. So first thing is you have to stop saying that to yourself. Oh, it's that time. You are gonna have a little bit of forgetfulness and brain fog and and tiredness. It's that time. No, it's not that time. The time has completely changed now. You just need more awareness, and then you find out what is missing and you work on it. Yeah, it's just and this. I mean, and now there's a lot of awareness about it, but people still are in that mindset.
Yeah. And the traditional medicine world gives that to them,
Yeah,
right?
yeah, yep,
Often
yep,
it's not us coming up with it,
yeah,
outside world, it's the conventional
yep,
medicine that gives us
yeah.
that.
So we have to remember that conventional medicine is very limited to like big randomized control trial, big studies. They are not like individual focused. When we are working with our clients, we have a relationship with them and we work with them. Hey, I see you. I'm meeting you where you are. I know what's going on. I know how many kids you have. I know who's your husband. I know what's going on in the relationship. We see them as a whole. But when Western medicine is dealing with this, they are looking at studies that was done in thousands of people whose name has been hidden. They don't know them. They don't know what's going on, what their thyroid. So what I'm trying to say is that an individualized care is very, very different as compared to a traditional medicine. So of course, they still go by, there are many, many OBGYNs that will deny you from hormone replacement therapy. And I, as a psychiatrist, people get very surprised when I tell my clients to speak up for themselves and get these testing done and then see if they would benefit from being on hormones depending on the risks. and the benefits. And they are still going by, Hillary, the old women's initiatives study that was done. And then I think that was the biggest blow on females, on women in general. Like, okay, what are they supposed to do when they're going through perimenopause? And it was just literally the answer is, oh, you are in that phase of your life. It's sad. It is very, very, very sad. And I try to empower, and I have seen that, if you push for yourself, and that's where I'm gonna go back to what I said before. We want you to have the power. Like, I have seen, Hillary, your clients, like, you're like, hey, you're not getting much benefit. It's a lot in your head right now. You need mental health help. And then you send it to me, right? Many times physicians have the traditional, they don't even have time. They don't have idea what's going on. And they're like, okay, here's your prescription, go.
But that's where this group approach comes, right? This is like,
Hmm.
we work as a team, and
Hmm.
that's very important, with the
Yeah,
patient or the client or whomever being the center of that,
yeah,
they're
yeah.
leading that.
Yeah, they're leading that. We hold them accountable. They might feel a little frustrated with us at times because, you would think a psychiatrist you saw once and then you don't see them for 3 months and no conversation. Not in my office, not in my place. I would tell you to send messages on my app and my electronic health record, and we have a system that if you message me, you are going to get a response in 24, 48 hours. And that's why the work we do that work, and we don't uh, associate with insurance companies, and we don't want people dictating how technically we are working. But at the same time, we want to be very safe, very mindful. We want to be, again, at the end of the day, we have a license. So we are going to hold you accountable because we are using measures which is so-called non-FDA approved. So we have to engage you and involve you and educate you, and you have to be with us in the journey. We are not those egoistic physicians or providers that, oh, you do this, you take this. I think people should understand that the medicine has to change. Like, we are empowering women and men and everybody, I think it's time we empower our clients. Like, this is what you're doing, this is what it is, speak up for yourself. And that's what I see with hormones, Hillary. It's just so many of my clients with ADHD like symptoms, and a lot of them with anxiety and sleep issues. It was big problem was, like, the doctors don't even know that if their client is in perimenopause or already menopausal now. Can you imagine this? A woman came to me, and then she was like, I am like, how many months has it been? And she said, oh, it's been more than a year. And I said, do you know you are postmenopausal now? You didn't get anything done in perimenopause.
Right.
And I am like, wow, so your primary care physician didn't even, so that's the sad part sometimes. So I mean, that's why we are here, right? I don't like to focus too much on the sad part.
It
That's why
is.
we are here talking.
And I think it's important to it's to find, there's people around, don't give up,
Mhm.
ask other physicians, such as
Yeah.
yourself. I'm sure you have a network of people you recommend. Go to a compounding pharmacy, because a lot of times, I guess, in a town, a small town, or even just a bigger place, we see more of those type of providers, as a compounding pharmacy. So that would be a good resource. But it's just find your people. They exist.
Find
Don't.
your people, and I will say to you, and even if whoever is listening to me, if you have a physician, a psychiatrist, a naturopath, acupuncturist, any kind of healer, provider, if at any moment of time you do not feel they are paying attention, you do not feel connected to them, or you do not feel like they care. The key part I say is they are listening. If they're not listening to you, run. Just run. And this is what Hillary insurance model does is, sometimes you're paying so much for the insurance already monthly that it's hard. And I don't blame people. It's easy for me to sit here and say run, but then it gets very hard for them to run from that structure, right? Um, but really think about it, that we only have one life, and how much, when is enough, you know? And find that tribe, find that vibe with your physician. Your physician has to be a teacher in your journey in your life, and should not have ego that, oh, do this, do that. If you don't do this, no fear, nothing. They should work with you, and you should feel like, oh my God, they really do have my best. And there are people out there. We might be less in number, but people are there.
There is. And there's more and more. It's getting more and more common.
Hmm. Yeah.
Is there anything else that we missed about ADD, ADHD? I think we've hit most of that. I'd like to talk about how people can contact you in your.
Yeah, yeah. So yeah, we will of course put our website and everything. So the name of my website is, so the my office is Sacred Balance Integrative Health. We are based in California, but we do have license. Of course, I see clients in Michigan, so we do have license in a couple of other states, in Michigan, in Pennsylvania, in West Virginia. But we are based in California. You can reach out to us just at our website, and I'm sure if there is a way, Hillary, I can we can put our website there. But we, like I said, we really, really believe in communication. So I can attach we have a HIPAA compliant cell phone number. I always tell people 747-200-0022. So I picked a simple number. So yeah, reach out to us, just, or you can find my name, Abhishek Rai MD, on Psychology Today. So there are multiple ways. But yeah, I always tell people, go to my website. You'll enjoy everything you read. Read the comments from the clients, and I just feel so blessed, Hillary, that some of my friends who are traditional psychiatrists, they reached out to me and said to me, "Oh my God, did you see your clients? Why did you put your client's name on the website when they were reviewing your website or giving you a review?" And I said, it was, of course, I asked them, and I feel so happy despite the mental health stigma. Hillary, all of them, like literally all of them. And these were the clients that I've had for like a year, and they were reaching that graduation stage. All of them said, no, we want our name included. And what the work we are doing with you, do you think that we wouldn't want to have our name? Why not?
Oh, there's no shame
Yeah.
in it. It's
Yeah.
that's a proud moment.
Yeah. So read those comments. If anything, I really feel we all are storytellers. We are doing we enjoy this work because hopefully we can help a little bit in your life story, your life journey, and we can have a positive impact. And so I love that part. So yeah, go to my website, check out, and of course you can always ask Hillary. You guys are in Michigan, she knows how to get hold of me, or she'll give you my contact to get hold. And I mean, we are on Facebook as well by Sacred Balance Integrative Health. We are on LinkedIn. We are on Instagram, all with Sacred Balance Integrative Health.
Awesome. Perfect. I think that was wonderful. That's exactly what I pictured. And thank you for your time today. Appreciate it.
Yep. Thank you so much. It's always, always pleasure talking to you. It's kind of like soul filling.
It is. Like, yes, it's much needed in this world. So
Yes. Yes, yes. And we love doing this work. So it always, when we do this, it's just kind of like, it's like, okay, nice. And we feel good, right? So I like it. I like it. Good. It's great connecting with you, Hillary.
yes, thank you.
Okay. Yeah, you're welcome. Take care.